Assalamu alaikum. I'm Dr. Gamal Sobhi from the Memorial Institute of Islamic Research in Egypt. My talk is about very famous complications appear to most of us is the consecutive exotropia after we do bilateral recession in case of intermittent exotropia. As you know that intermittent exotropia resembles about 70 to 80% of exotropia all over the world. And we also know that the four types of intermittent exotropia are basic type, divergence excess type, convergence insufficiency, and lastly, the simulated divergence excess intermittent exotropia. We know that bilateral recession is the most used surgical technique in the treatment of intermittent exotropia. The goal of bilateral recession in intermittent exotropia is to do a very small, not more than 6 breath diopter exotropia. This is considered a successful result and a promising result. Some authors write this famous type that if you are not getting some cases of consecutive exotropia in your cases, you have to know that your recession is too small and you have found many cases for you having residual exotropia. The results of bilateral recession in case of intermittent exotropia, either patient with orthotropic or residual exotropia, or lastly, the consecutive exotropia, which is our talk. The rate of consecutive exotropia differs largely in different authors. Starts from 2.6% of cases will show consecutive exotropia after surgery, as show right. Then Park writes that 25% of cases have consecutive exotropia, which is very, very high incidence. What are the predisposing factors for consecutive exotropia? First is the age of the patient. A very young child, less than 4 years of age, or a very old patient, this will show a high incidence of consecutive exotropia. Second, predisposing factor is the incidence, it's very important, the incidence of intermittence. We notice that if there is good control of the exotropia, differs mainly from bad control. Patients have good control, are liable to show consecutive exotropia after we do bilateral recession for them. Also, it's more common to find consecutive exotropia in the type of divergence excess intermittent exotropia. Here, the incidence of consecutive exotropia is higher than other types of intermittent exotropia, as basic and others. Also, of the predisposing factors of the presence of consecutive exotropia is high refractive error, high myopia and hypermetropia. High myopia are liable to consecutive exotropia, anisometropia, amblyopia, and high AC to A ratio. In case of bilateral recession, the finding of consecutive exotropia as a complication is more than if we do another surgical regime. What is the treatment of consecutive esotropy. The main treatment is to wait, to conservative treatment, either by occlusion, correction of hyperopia, treatment therapy, and others. For how long? Many cases show a spontaneous recovery after 1 month, like this girl. Other cases show a spontaneous recovery after 2 months, like this child, 4 months, like this child, and lastly, after 5 months, like this child. The management of consecutive esotropia is either by unilateral medial-rectus recession or bilateral medial-rectus recession according to the angle of deviation. My conclusion is consecutive esotropia after bilateral rectus recession disappears in most cases by conservative management only by 6 months of life. Thank you.
Thank you, Mr. Clement.